Hi, I'm Erika Lautenbach, the director of the Whatcom County Health Department. Along with our co-health officers, have prepared a short video for you that answers a lot of the questions we've received from our businesses, other organizations, and individuals about the upcoming changes to the mask mandate and some other changes that we are seeing and anticipating. So as you may know, COVID-19 cases in Whatcom County have fallen rapidly over the last month and are now at pre-Omicron levels, which is great. But please keep in mind that COVID-19 is not over for good, especially for people who are at higher risk. Last summer, many of us thought and hoped that the pandemic was over, only to be clobbered by both Delta and Omicron. I want to say, though, to please not be discouraged by the possibility of another surge, but also don't be overconfident that we've seen the last of COVID. One of the things we've learned in this long 2 years is uncertainty is the only certainty we've had with COVID-19. So we do need to be prepared for another surge, but also optimistic about what we're seeing right now. So again, we've gotten a lot of questions about the state mask mandate, which will be lifted on March 12th. And our co-health officers, Dr. Amy Harley and Dr. Greg Thompson, are here to answer them.
So after nearly 2 years of us using masks to protect ourselves and protect our communities, it's understandable that some people are concerned with the lifting of mask mandates. That said, it's important to understand why we've been using masks and why we're at a point now where I do believe that it is safe to lift that masking requirement. So the reason that we use masks and use social distancing and some of these other measures is to keep our case rates and our hospitalizations low enough that we could get to a point where we're not overburdening our hospital systems and that we have time to develop immunity through things like vaccines and develop therapeutics that can prevent us from developing severe disease, hospitalization, and death. And now we are at that point. Our cases are at a level that is lower than we've seen since July of last year, and our hospitalization rate is also lower than we've seen since the very beginning of the Delta surge last year. So we're now at that point. It's still important, though, for people to realize the best way that they can continue to protect themselves is through being vaccinated and boosted. And even people who have been infected with COVID before are better protected if they get vaccination after their infection than if they were unvaccinated. So within Whatcom County, we don't currently have any plans or expectations to extend a mask mandate beyond what's required in the state of Washington. And we are at a point here in the county where our case rates and our hospitalization rates are below the level that CDC would consider masks to be required universally. We're also at a point where we are having lower case rates and lower hospitalization rates than most of Washington state and most of the US. So I don't think that there's any reason at this point that we would consider extending a mask mandate beyond those that are required at the state and national level.
I think of safety as being dependent to a large degree on your own personal assessment of risk, the environment you're in, and the outcome which you're trying to avoid. Certainly, we're at a point in the county where it is much safer to be in public indoor settings without a mask. It doesn't any longer feel like you're going to bump into someone with COVID with every trip to the grocery store. However, it is true that many people will still choose to wear a mask due to their own health concerns because they have children too young to be vaccinated or because they have a loved one with a compromised immune system. We can all contribute to creating a safe environment in our county for everyone by being respectful of others' decisions to continue masking. Certainly, parents with school-age children have expressed quite a bit of nervousness about less masking happening in schools. We are closely monitoring the situation in schools and working hard along with the schools in Whatcom County to watch for outbreaks or clusters of infection, and we'll respond with interventions to to mitigate any transmission that we see occurring in schools. Some situations in which mask wearing is particularly important is if you've recently had COVID infection or you have symptoms of COVID. Those are situations which we would want you to avoid crowded settings or wear a high quality, well-fitting mask, such as an N95, KN95, or KF94, as is still the CDC recommendation for isolation after COVID infection. You know, we're not making recommendations about the exact distance that you keep between yourself and other people and how stringently you avoid settings where you're unable to maintain physical distancing from others. Really depends on your level of risk that you have assessed and the level of risk in your family or in your community. So we do think it's a great idea to avoid overcrowded settings if your personal risk is higher. If you're in a category medically where you're more vulnerable to infection, or if you're not up to date on your vaccines, it still makes sense to avoid crowded settings to the degree possible.
Yeah, so we're certainly hopeful that we're not going to experience another surge, but there's no way to guarantee that. And we have to be adaptable and flexible in terms of how we protect ourselves and how we protect our communities. So at the county level, at the state level, and at the national level, we're monitoring case rates, we're monitoring hospitalization rates, and we're monitoring how overwhelmed our hospital systems are. And it's possible if cases reach a level again where it becomes necessary that universal masking could be required. I think it's most likely that we would begin with recommending further interventions before we reach a point that a requirement would be needed. But at this point, it's too early to say exactly what the future is going to bring. So I can't make that guarantee, but certainly our intention would be to encourage voluntary masking first and encouraging all the other measures that we can take to prevent spread of disease before we made a mask mandate again in the future.
One of the reasons that we now feel it's reasonable in Whatcom County to relax prevention measures such as masking and social distancing is because pharmaceutical interventions to treat COVID infection are so much more widely available. We know that healthcare providers in our community have been working hard to ensure the availability of antiviral medications and monoclonal antibodies that can treat COVID infection. So we really encourage people to if they have concerns, to reach out to their healthcare provider and know how they would access these available treatments if they needed them.
I hope the information that our health officers and I provided was helpful to you, and we anticipate there will be additional changes, new information. If you'd like to stay abreast of all of this, we update our website regularly, and it's www.whatcomcounty.us/COVID. We also update our Facebook really regularly, and if you'd like to subscribe and like that, you can receive that on your feed and get more regular updates that way too. Stay safe, everyone. Stay well. Thank you for hanging in there. It's been a long 2 years, and we are hopeful and optimistic that 2022 will be a brighter year for all of us. Thank you.